Hello everyone, you're watching sqadia.com and now we are on the treatment end of osteoarthritis. We'll be going through what is the symptomatic treatment of osteoarthritis, what are the disease modifying therapy for osteoarthritis, and what are its principles of therapy, and what are the surgical options we can use for treating osteoarthritis. As you know now, that this is a very common day occurrence of people going under through hip replacements, knee replacements, shoulder replacements. End stage of a now joint failure, and the joint has become so fair that it cannot actually function as a proper joint. The end stage is replacements. But before going to that, we need to have certain principles how to treat osteoarthritis and how to treat them in a step ladder pattern. That is, starting from simple things first and then eventually moving to complex surgeries. Now this is a treatment pyramid. If you see it over here, the most base, it is the information and advice, education, weight loss exercises, and lifestyle alterations. For example, somebody is having osteoarthritis due to manual work of his pincer grip and having a problem thumb, then we can ask the patient to not do the same thing over and over and not do that kind of a movement in repeated manner, and there has to be some degree of occupational modification as well. If a patient is obese, the first thing, and the patient complains of knee osteoarthritis, we need to tell them that unless you do not lose weight, the stress on your joint will not be lessened. So weight loss is the first lines of treatment times. Then there are certain self-help exercises, simple analgesics, topical agents, lifestyle, and nutricals. Now these are all can be given to the patients, and when they do physiotherapy and increase exercise, these exercises not only reduce the weight but they also help to build up the muscles around the joint. Now every joint, there are certain muscles acting along it, and those muscles act as a dynamic stabilizer. So if a patient will have a strong muscles, not only it will improve its pain symptoms and this will be better for the patient, but even if we have to proceed for the surgery, having good muscles is actually helpful for, and usually the surgery and the replacement is be done with the healthy muscles is actually far better results than those with the patients the surgery was done with weaker muscles. Now coming to the other, then it's simple non-surgical interventions. Then we do not straight away go to replacement. It's kind of a step ladder pattern. You tell them, you advise them, you make them modify their lifestyles. Then some self-help medications, self-help exercises. Then if still the pain is not controlled or they're still having problem, then we could start with simple anti painkiller medicines such as non-steroidal anti-inflammatory drugs such as physiotherapy, occupational therapy, orthosis and aids, and simply opioids, and all these drugs can be used. But if still it's not working or it's getting worse day by day, for example, it's over the years or 2 years, 3 years, it's actually worsened, then intra-articular steroids is an option. It does provide relatively temporary relief. But if after exhausting all these options, if the patient is still having a problem and actually over the 2 3 years 4 years time, actually the joint has failed miserably and there is advanced osteoarthritic changes in the joint, then probably the last option or last resort is to replace the joint and needs the total knee replacement, and the hip is total hip replacement. So the steps of the treatment is important is to take a holistic approach. The option is not to straight away go for the replacement of the joint if you see osteoarthritis. Take a holistic approach, introduce core treatment modalities appropriate to the patient, introduce non-surgical option first, which includes both non-pharmacological and pharmacological. Pharmacological includes the NSAIDs, opioids, and sometimes you have to go antidepressants as well in these chronic pain patients. And non-pharmacological includes aids, then orthosis, and these devices which actually a lifestyle modification, and exercise and physiotherapy which actually reduce the biomechanical stress on the loading on the joint. And fifth, if all these fail or if it's the patient still progressing and in the osteoarthritis is still progressing and there's increased joint changes, Then probably the last resort is a surgical option, that is the replacement of the joint. How to take this holistic approach? Step one is assessing the impact of the individual's quality of life, function, mood, relationship, and activities, and thinking about their context and their comorbidities. Thinking about the potential risks and benefits of any intervention, self management strategies. The second is appropriate treatment for the appropriate patients. You cannot give one treatment to all the patients. Certain patients are different in certain aspects, and the treatment has to be tailored accordingly. Provision of information about the condition and its management, helping people to increase their exercise level. Then third step is the non-surgical options, which include pharmacological and non-pharmacological. Now the non-pharmacological interventions include supervised courses of physical therapy, use of aids and devices that reduce the instability of and help with functional problems, walking aids such as sticks and crutches, some electrotherapy techniques such as stents machines for pain control, manipulation, particularly in case of hip osteoarthritis with reduced range of motions at the hip. Now, after exhausting all these non-surgical options such as NSAIDs, opioids, analgesics, intra-articular steroid injections, and all these nutricals, then we have to move towards the surgical option, and that includes actually the most common is the joint replacements. But joint replacements are not the only option. Surgical option could mean joint realignment. This could mean joint fusion, as in case of orthodesis, joint excision, or joint replacement arthroplasty. Nowadays it's more common and convenient to go for arthroplasty, because such as for example joint fusion and orthodesis, although patient does becomes pain free, but the problem is the movement is actually lost at the joint. And in joint replacements, although there is at times there is a decrease in the movement, but yes, patient is able to carry out its activities of daily living with joint replacements. Then in subtypes includes the total or the partial. Total means the total hip or total knee replacements or total shoulder replacements. Simply know they were partial, for example bipolar hemiarthroplasty in case of hip, or bipolar shoulder arthroplasty in case of shoulder. These are the techniques which are being frequently utilized, and now the world is actually moving towards replacements of more joints, for example elbow, ankle, metatarsals, and all these. And as this science is progressing further, there will be further enhanced designs which would be more biological or biomechanically more close to the human body. Thank you very much. Keep watching sqadia.com.